The business is still the same. It still comes down to taking care of a patient, and doing the very best we can for that patient every encounter, every time.
Manhattan, Wichita, Salina, Lincoln, Nebraska, Omaha, Sioux Falls, South Dakota. These are not places that fancy corporations want to go. But yet I always find physicians like you. They're very similar, and their heart says, I want to take care of my community.
We firmly believe, if you take care of your community is going to take care of you. And I just figure you do things for the right reasons, the other things follow. It sounds pretty simplistic.
Doesn't it though?
Yeah. Somebody else talking about that this afternoon as well. It gave me great heart to hear somebody else other than me say it. I really think physicians should take back healthcare, put our patients at the center of everything that we do so that we do the right things by them, and we can do this one community, one hospital at a time.
All right. Listen, another fantastic mini episode of the Doctor's Lounge. Today we're at PHA 2025 in Santa Fe, New Mexico with co-host Dr. Anthony DiGiorgio and one of my favorite people in the entire world, Dr. Carlos Cárdenas. Welcome to the show. So happy to have you.
Great to be here.
And you're president, finally. I'm so excited. How's it feel?
I'm pumped about getting ready to move forward on the good work that was started by two of my predecessors, Fred Liss, of course, and Joe Alhadeff, who
we
really
just
laid it
talked
out.
to Fred like 30 minutes ago, and he was pumped. He was like, oh my gosh, I'm so excited about Dr. Cárdenas.
It's an exciting time. I think that we've got major challenges in the healthcare community, but the basis, the heart and soul of everything begins at the bedside. That's where we get our energy. That's what helps us to make choices and decisions that help not only our patients, but we take the same principles and apply it to the community at large. You can do all kinds of things.
I love your saying, bedside, boardroom, bedside. I'm going to post it on my wall or something.
I have a fellow of mine who just moved back, actually started working with us, told me there's a few, he calls them Dr. C-isms that he wants to put on T-shirts. That's what I'm going to tell him about.
Yeah, that's a good one.
Put that one on the T-shirt.
A good one. Now, for our guests who don't know anything about you, I really want them to know. So let's talk a little bit about your hospital. Will you just kind of walk us through the formative years, kind of what you guys decided to do and how you guys decided to do it? Because this is a great story.
Back just before, it was probably 1995 or so, a group of, actually one of my closest friends, a general surgeon, the two of us were both from the same hometown, and we're both working together. And I had gotten it in my mind. I'm a practicing gastroenterologist, so I digress for a second. But I sort of had my eye on maybe building a GI endoscopy suite, and for myself and my partners, and we thought that might be a good direction to go, where we could have some control over how that works and what the patient experience is and all aspects of it. And my close friend, who's a general surgeon, said, why don't we do a multi-specialty day surgery center? And I said, well, you convinced me over a glass of cognac and a cigar. I don't smoke many cigars, but on occasion, in the remote past.
Yes.
That's my disclaimer. Right. But in any case, that's how it was done, basically like on the back of a napkin. We were talking about it and trying to map out what we thought we could do. And we were able to come together with other like-minded specialists at the time to build a day surgery center. And so day surgery at Renaissance was born, and we opened our doors in 1997. By 2003, we had decided to grow that partnership. We had expanded our day surgery center. Under the law, it was possible to form a whole hospital. And we felt it would be important to include other colleagues in the community to help us to build a hospital. We had two for-profit chains in our hospital, rather in our community. And so we decided that, physicians know how to care for patients. Like I said, we go from the bedside to the boardroom back to the bedside, and we can make choices and decisions, decide what equipment to buy, what nursing staff ratio should be, how many patients to a nurse, those kinds of things to optimize what we already know how to do. I'm not the world's greatest business person. So we had an amalgam with a business leader who had a similar vision that he wanted to transform healthcare in our area and bring more healthcare and more access to the patients in our community. And so, DHR Health was born, and we ended up expanding the partnership in the day surgery, and then able to include other members of the medical community. We went into a whole hospital, and so we built 30 beds. Opened our first the first facility was 30 beds, and we did that in February of 2003. And then we were adding a service line or beds every 6 months until the moratorium passed. And so today we're a 520 bed facility, full service hospital with, we're the first, I could go through a variety of firsts here, but we were the first hospital to actually build a level 1 trauma center in our community, and that was a wonderful achievement for 1.4 million people in the Lower Rio Grande Valley. And we as colleagues went to each of the county commissioners' courts to explain why we thought it was necessary to do it, and we're asking for their letter of support to be able to get it done, to go to the state to draw down the monies to be able to launch and give birth to what became a level 1 trauma center, and that's what we are today. We have a neuroscience institute as well. We're now doing renal transplants. We have actively working on saving limbs with our vascular surgery team because diabetes is very prevalent in our community. And working on doing a variety of other things, including graduate medical education, because I think that if we're going to recruit and retain and we have to grow our own. And that's really what it was all about. So I think I'll be quiet now and let you ask me a couple of questions.
I think that's so amazing that you have a physician-owned level 1 trauma center. I mean, just the amount of investment you have in the community that shows by you establishing that trauma center. So I subspecialize in neurotrauma, and one of the things that I've heard when talking about physician-owned hospitals is that the only niche for physician-owned hospitals is the subspecialty, the one-stop shop, the orthopedic hospital, et cetera. You're proving that wrong by having a very successful level 1 trauma center that's physician-owned.
And I have to tell you that, we didn't come to these decisions lightly. We grew from what was a granular day surgery center, but the principles were the same. The principles were to put the patient first, put the patient at the center of every single thing we do, take the energy that you and I have as physicians, the reason we got into doing what we do, and take that energy and then do other things like build and bring service lines to a community that needed them. I mean, I grew up in that community. We had to travel a long way. I had a younger brother who was afflicted with spinal muscular atrophy, and we had to travel to Galveston, Texas at UTMB, where I trained. That was my alma mater. But, they told my parents he wouldn't live to see his 15th birthday. Now he lived to be 50, but so he flew in the face of the odds there. But the point is that my story is the same as almost any other family in our area where we didn't have access to the subspecialists and others, and we didn't see that movement happening in other centers that were in our area. So who better than us to do it ourselves? And that's what drove it. I mean, a lot of what drove it.
I love the story because you are effectively rural. What's the story that you've been telling in Washington about how physician-led healthcare and physician-owned hospitals can absolutely revive the healthcare deserts that are in the United States?
So I think if we go back in time, in history, and I think Fred Liss was alluding to this earlier today. The first hospitals that were built in the United States were built by doctors.
Yes, they were.
And or their families. The first hospital in my community that actually functioned as a hospital was the home of a physician. He and his wife, they lived upstairs. The hospital was downstairs. They had a ward of about 8 beds, and it's in my own community just after the turn of the century, and in the 20s and 30s. And so it's a natural thing for us to do this. And when we see systems and other things failing around us, sometimes it's time to look back and rekindle the same spirit and energy that it took then. What's happening in rural America right now is a very difficult thing. And There are still pockets of physicians in those communities that maybe if they had the opportunity to build their own, they could come together to build their own with like-minded. And if they take the shackles off, we could do a whole lot of things. Because the truth is, we're just a different business model than we are. But on the business side of it, it's the ownership model. The ownership model is a little different, but the business is still the same. It still comes down to taking care of a patient, and doing the very best we can for that patient every encounter, every time.
Yeah, I think when I talk to the MBAs and the large companies, they have no desire to be in these small towns. As we drive through them and fly to them, I mean, we're in every single small town across all of the United States. And everywhere I go when I visit a physician-owned hospital, be it you guys down in Brownsville, or whether I'm somewhere in East Texas, or I'm somewhere in West Texas where I'd never been before, or I'm driving through all these crazy parts of Kansas, Manhattan, Wichita, Salina, Lincoln, Nebraska, Omaha, Sioux Falls, South Dakota. These are not places that fancy corporations want to go. But yet I always find physicians like you. They're very similar, and their heart says, I want to take care of my community. And that's what I want to do. And that's a good business model. That business model says if I can take care of patients, that's what I want to do. And if I can make enough money to do that, that's good. And I still don't understand why the American government wants to take that away from physicians.
No, I think it's something they should rekindle, and it's particularly, I think, something that we could help to do in rural America. We work and have had a partnership with Stark County Memorial Hospital, which is about 40 miles as a crow flies from where we are, an hour effectively. If you were in the back of an ambulance, it's about an hour to get from there to us. So sometimes we'll fly people from there, especially in a trauma situation. But where I'm going with that is that in Stark County, we forged a partnership with them, an affiliation, if you will, back in 2014, and have been working with them for a really long period of time. We now are getting ready to launch in 2026. We're going to have, we hope to have, we've got to go through the hoops, but to have an accredited family practice, rural health residency, and internal medicine rural health residency, and we'll be teaching in that community. I've been working in that community off and on since I started my practice, just about for a really long time, and we have a specialty clinic there, and I go and I would do endoscopies there in their hospital to help that hospital and still keep people home so that they didn't have to travel to come to our facility to be able to be treated. So the partnerships bear fruit, and it's the right thing to do. We firmly believe, if you take care of your community is going to take care of you. And I just figure you do things for the right reasons, the other things follow. It sounds pretty simplistic.
Doesn't it, though?
Yeah. I heard somebody else talking about that this afternoon as well. It gave me great heart to hear somebody else other than me say it. But it's the truth. It really is the truth.
How did your involvement with PHA start? And then what caused you to kind of really, say, like, I really want to be involved? And then kind of tell us a little bit about what the message is going to be over the next few months.
My involvement with the PHA began, I'm trying to remember I was trying to think about that earlier today, how many years ago it was. I kind of forgot. It's been a while.
That while.
Yeah, it's been a while.
Yeah.
In the beginning, we were going to Washington ourselves as DHR Health. We were going to Washington and fighting these battles one-on-one, and our congressman at the time was incredibly helpful to us, and so kind of knew my way around the Capitol, both in Austin and in D.C., and I was very involved in Texas Medical Association. I also knew that if you're not at the table, you're on the menu, and in order to be at the table, we felt like we needed more of a presence in Washington, D.C. Well, PHA was that organization that represented people like me, and people who had thoughts like we did. In the beginning, I wondered, well, we are a little different because our ownership is different, and our model is a little different because we were all a whole hospital, general hospital, approach. There aren't that many of us in the United States. But certainly it's a lot easier to go in with numbers and more people who are like-minded when you want to pursue a change in legislation, or you want to just, start something new, or you want to raise awareness. It's better to speak with many voices than with just one voice. And so PHA was that vehicle, and I got interested. And then I'm trying to remember, it may be the first meeting that I went to, and we joined the PHA, and they saw fit to ask me to join the board. I met Dr. Fred Liss, and gosh, I felt like I'd met my brother from another mother.
Yeah.
I mean, Fred, if you're listening, take that to heart. The truth was that we were saying a lot of the same things, and we were thinking similarly. And so I found sort of a kindred spirit, and that made this even more real. And I decided to get involved, and I believe in the vision. I believe in the passion. I really think physicians should take back healthcare and put our patients at the center of everything that we do, so that we do the right things by them, and we can do this, one community, one hospital at a time.
That's amazing. I think that speaks to the essence of why physician ownership is so important, is because we can take the community at heart. And when you think of the legislative priorities from lawmakers, it appears that they would rather say to Medicare and Medicaid patients, you cannot go to that hospital, right? You cannot use that physician-owned hospital. We can go ahead and start physician-owned hospitals. We can start these high-quality institutions, but as of right now, legislatively, Medicare and Medicaid patients are excluded from using those. And there's plenty of economic data showing these large hospital corporations consolidate. They actually harm their local communities when they raise their prices, and local businesses can no longer afford, their healthcare costs. But meanwhile, here you are, actually helping your community, making it better. And yet legislatively, we're saying, no, what you're doing is wrong, but what these large hospital corporations are doing is actually the right way to do things.
I felt that we flew in the face of conventional wisdom. At the time, most people didn't give us a prayer of surviving, and it got really very ugly early in our history, when I couldn't, it was very difficult for us to get an insured patient through our doors. We were seeing Medicare and Medicaid. We were licensed. There was active work in our community to try to keep people from coming to us. Well, we kept at it, and we wouldn't say no. We never turned anyone away. We find a way to work it out. And so today, we are, I didn't talk about our obstetrical program, but we deliver close to an elementary school full of children a month in our facility, and the majority of those children are Medicaid, which is a large number. Probably 80% of our volume in the beginning was all Medicaid, and we do a lot of indigent work. We've done an incredible amount of indigent care, because we've never turned anyone away. I mean, I built my practice on those principles. I had to live when I came back from training to practice in my community. I knew from the beginning that I was going to do that, but that's how I was raised. So we just took those principles, and all of us were like-minded about it. Nobody turned anyone away. To this day, we've never turned anyone away. We take care of all in our community. I figured, honestly, you do it for the right reasons, the rest of it follows. There's enough of everything else, and we do enough to where we have enough to care for our patients in our community. But that's what it's all about. And it's pursuing each one of those things with those ideas. And, I know it sounds kind of, Pollyanna or whatever. It's not Pollyanna. It's real, man. It's the truth. I pinch myself every single morning when I go to work, because I can't believe we actually did it, that it actually happened.
I feel like there's so much pessimism, in the physician community.
Yeah.
Like, I can't do it, I can't do it, I can't do it, I can't do it. And I think what we need is just more examples like you.
Sometimes I wonder, I'm not sure we knew any better at the time that we were doing this. We were all very young. We were probably under 4 to 5 years out of training when we got together and decided to do this. And then each of us go into our pockets to put up the initial funds to build a day surgery center, and go to the bank and ask for the loan. The rest of the company, community thought we were crazy. So you guys are going to go, broke and blah, 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 blah. Well, that almost happened. That almost happened.
All right, so what are you looking forward to most during this particular meeting?
What I'm looking forward to in this meeting is, again, walking out of here with the energy that we're going to get a few things accomplished. And the pretext has already been laid, by both Fred, Liz, and Joe Olideff. And we're moving forward with the CMMI project. We're hoping to try to get that done as sort of an experiment to show the Congress that there's things that we can do that, and sometimes you just need to see the proof to be able to move forward. And we're going to work on the 222 rule and see what we can do legislatively to make some things happen. I think we probably never had a better opportunity to achieve these two things than we will right now with the way the energy's been going. We actually had a meeting at the White House that happened, I guess, during our Washington fly-in this year.
Yep. And
of course, that was very exciting because that means that some people are, paying attention and listening to us. And so, I think it's a good time to be part of the PHA and think about what it is that we can do, because we're certainly going to be able to do more together than we will apart.
Well, sir, thank you very much for joining Anthony and I today. We love your energy and your passion. We're looking forward to your leadership this next year at PHA.
It's an inspiration. Thank you.
Yes.
Thank y'all for having me.
I love it.